Grey zone. This is an area for the wearer to scrub up and put on the main cleanroom attire. White zone. This is a clean area where the wearer changes into their clean room footwear. The wearer is required to remove facial cosmetics and jewellery. Bouffant cap and overshoes are to be worn prior to entering the grey zone, if needed. Sanitize hands prior to donning the first sterile gloves. Carefully retrieve the content from the packaging. Open the inner wrap using the flaps. Once opened, press down on the corners of the inner wrap to keep it opened wide. Grip firmly at the folded cuff and slide the other hand into the glove. Pull the folded cuff towards the wrist. Slip the fingers of the gloved hand into the folded pocket of the folded cuff. Slide the other hand into the glove and unfold the cuff over the sleeve. Using the gloved hand, unfold the cuff until it overlaps the sleeve. Decontaminate tabletop and bench with sterile wipes. Use new surface of wipe for each wiping. Position the face mask with nose piece across the nose bridge. Adjust for a good seal. Retrieve the coverall from the package. Only touch the inner surface of the coverall. Grab the coverall at the waist area. Insert one leg into the coverall and place the donned leg at the white zone. Repeat with the other leg. Bring the coverall up towards the shoulder, then insert the arms into the sleeves. Pull the hood over the head to make sure it covers over the hairline. Cross your legs and zip up the coverall fully. Remove the backing liner and stick the flap over the zipper. Insert thumbs into thumb loops. Pull the goggle's headband over the hood. Adjust the goggle to ensure no exposed skin. Tighten the headband for a secure fit. Fasten the tie strap for secure fit to the leg. Retrieve the apron from the packaging. Hold the apron on the inner surface to unfold. Put the apron with the neck strap over the shoulder loop, the neck strap behind the neck, and connect both ends. Tie the waist strap for secure fit. Slide the hand into the half-folded sleeve until the elastic cuff reaches the finger. Grab the inner surface of the elastic cuff and unfold the other half to the arm level. Avoid touching the external surface during the donning. Grip firmly at the folded cuff and slide the other gloved hand into the outer glove. Pull the folded cuff towards the wrist. Slip the fingers of the sterile hand into the pocket formed by the folded cuff. Slide the other gloved hand into the sterile gloves and unfold the cuff over the sleeve. Use the sterile hand to unfold the cup of the first sterile glove until it overlaps the sleeve. Ensure all the coverall and accessories are correctly fastened and secured prior to entering the cleanroom. There should be no skin, hair, or inner coverall exposed.